Every year, we do more and more prosthetic operations, silicone implants, and there are different implants operation going on compared to the past years, like calf implants, leg prostheses, correcting the bandy legs, or for example, pectoral implants to bring out pectoral muscles in men, glute prostheses for both women and men, to make the glutes more definite. Now, there are many general rules about these surgeries. So let me just talk about this to give information to people who want to undergo prosthetic surgery. These surgeries don't really have much detail. I think there are three important tricks. First, the right way to choose the right patient. Is the patient suitable for this surgery or not? This is very important for some prosthetic surgeries, like a glute prosthesis. Glute prosthesis is not an operation for everyone. In some patients, you don't see any effects. As far as I can see, older people, people with cellulite in their hips, overweight people. Prosthesis surgery does not give very good results in those patients. At least it doesn't make any sense when the patient is naked. Other than that, breast prosthesis is a surgery that generally gives good results in everyone. Also, if sagging is also present, breast prosthesis must be performed with lifting. I recommend that you have an experienced surgeon perform a leg prosthesis, because leg prosthesis is the most difficult in these surgeries. I think it's even harder than a glute prosthesis. Prosthesis must be in the muscle, right inside the calf muscle. And it's a little hard for an inexperienced surgeon. Apart from that, it is necessary to choose the right patient. The second key point is to choose the prosthesis correctly. Prosthesis that is suitable for the patient. If the prosthesis is too large or too small for the patient, or if the type is not suitable for the patient, you cannot get good results. You must choose a suitable prosthesis for the patient. What is that? For instance, we sometimes use drip prosthesis on the chest. We use a drip prosthesis for a reason. If it is not necessary, we don't use it. I'll tell you that. Because the problem with these prostheses is the risk of turning. There's a position of a drop-shaped prosthesis. The thin part will be up there, the thick part will be down. But in there, it can turn. If it turns, it will distort the shape of the chest. So unless we have to, we don't use it. So I will make a note of that too. The third point, put the prosthesis in the right place. If it is a prosthesis surgery for the muscle, if it needs to be placed inside the muscle, then it has to be put in the muscle. For example, the glutes. Prosthesis for the hip region cannot be on the muscle. If you put it on the muscle, it becomes visible, palpable and fat. It's definitely going to be put in the muscle of the glutes, in the buttocks. Apart from that, for instance, prostheses are placed on the leg muscles under the fat and under the membrane of the muscle. I don't recommend it because it would appear too distinctive in the future. I recommend putting it inside the muscle. In fact, I have a surgical instrument for the leg that I have developed especially for this, which is patented by me. An Istanbul-based company is selling this to the plastic surgeons. This is a tool that made calf implant surgery much easier. There's a video on YouTube. I represented this at a surgical congress at the Aesthetic Surgery Convention. My absolute recommendation is to perform this surgery with that tool. It makes the operation easier. There's no bleeding at all, and it ends in 45 minutes, including 2 legs. And apart from that, choosing the right patient, choosing the right implant, and putting it in the right place. If these are done, if the right decisions were made, then the results would be excellent. Patients would be satisfied. In these surgeries, the prosthesis is doing all the job. You know what they say, a bad workman always blames his tools, and there is a little bit of that. I just need to choose the right prosthesis and put it in the right place, in the right patient. You don't have to do anything else. After that, it will function a prosthesis anyway. Implant surgeries are usually the surgeries with the highest levels of satisfaction. There's a list abroad on the website. It is called Was It Worth It? A list of whether it was worth your surgery. There, the implant surgeries are always at the top. You will find it in top 5, especially breast prosthesis. The patients who had these surgeries are the most satisfied with. You choose the right implant for the right person and place in the right place. That's the principle, I think. If you want to ask questions about these things, I will have all the contact information on my website. And at the end of this video, you will see my email address and the numbers you can reach on WhatsApp. You can send questions there. When you send a question, if your question is a visual issue, then please send me a picture of where the problem is. If I can see it, I can give you a more accurate answer. Also, be patient because there are too many messages coming in. I try to answer everyone. Sometimes it can be taking a week long to reply. Therefore, I kindly ask you to be patient.